Colestipol is a bile acid sequestrant used as an adjunct to diet and exercise to reduce LDL-C cholesterol levels in patients with primary hypercholesterolemia. In this video, let's found. What is Colestipol? What is Colestipol used for? Contraindication. What are the side effects of taking Colestipol? How does Colestipol work? How to use Colestipol? What is Colestipol? Colestipol, trade names Colestid, Cholestabyl, is a bile acid sequestrant used to lower blood cholesterol, specifically low-density lipoprotein, LDL. It is also used to reduce stool volume and frequency, and in the treatment of chronic diarrhea. What is Colestipol used for? Colestipol is indicated as adjunctive therapy to diet for the reduction of elevated serum total and low-density lipoprotein cholesterol, LDL-C, in patients with primary hypercholesterolemia, a condition that features elevated LDL-C, who do not respond adequately to dietary changes. Therapy with lipid-altering agents like Colestipol should be a component of multiple risk factor intervention in those individuals at significantly increased risk for atherosclerotic vascular disease due to hypercholesterolemia. Treatment should begin and continue with dietary therapy. Contraindication. Colestipol is contraindicated in hypertriglyceridemia, high level of triglycerides in the blood. Side effects. The following notable side effects may occur. Gastrointestinal tract disturbances, especially mild, occasionally severe, constipation. Sometimes increase in VLDL and triglyceride synthesis. Pharmacodynamic. Cholesterol is the major, and probably the sole precursor of bile acids. During normal digestion, bile acids are secreted via the bile from the liver and gallbladder into the intestines. Bile acids emulsify the fat and lipid materials present in food, thus facilitating absorption. A major portion of the bile acids secreted is reabsorbed from the intestines and returned via the portal circulation to the liver, thus completing the enterohepatic cycle. Only very small amounts of bile acids are found in normal serum. Cholestipol hydrochloride binds bile acids in the intestine, forming plex that is excreted in the feces. This non-systemic action results in a partial removal of the bile acids from the enterohepatic circulation, preventing their reabsorption. Since Colestipol hydrochloride is an anion exchange resin, the chloride anions of the resin can be replaced by other anions, usually the greater affinity for the resin than the chloride ion. Mechanism of action. Colestipol is a lipid-lowering polymer that binds with bile acids in the intestine, forming a complex that is excreted in the feces. This non-systemic action results in a continuous, partial removal of bile acids from the enterohepatic circulation, preventing their reabsorption. This increased fecal loss of bile acids due to Colestipol hydrochloride administration leads to increased oxidation of cholesterol to bile acids. This results in an increase in the number of hepatic low-density lipoprotein, LDL, receptors, and consequently an increased uptake of LDL and a decrease in serum/beta lipoprotein or total and LDL cholesterol levels. Although hydrochloride produces an increase in the hepatic synthesis of cholesterol in man, serum cholesterol levels fall. Half-life. Colestipol is not absorbed into the systemic circulation nor is it hydrolyzed by any digestive enzymes. Its action is ultimately limited to the lumen of the gastrointestinal tract, where it is eventually passed into the feces. Dose. Hyperlipidemia. Tablets, 2g Q-day or Q12HR, increases of 2g should occur at 1 or 2 month intervals, titrate not to exceed 16g/day. Granules, 5g Q-day, increases of 5g should occur at 1 or 2 month intervals, titrate not to exceed 30g/day. Safety advice. US FDA pregnancy category, not formally assigned to a pregnancy category. That's all the information about Colestipol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.